Good afternoon, everyone, and welcome to this, what did Monty Python used to say, and now for something completely different. So what I want to talk to you today a little bit about is the community engagement and how civil society is contributing to awareness and prevention of snakebite in Nepal. So a short, very brief outline of the talk. We'll begin with a short history, identifying who is most vulnerable, and an overview of the knowledge products that we are using for the media campaign and what we have learned so far. So how serious is the problem of snakebite in Nepal? Well, according to a Lancet publication of last year, the latest findings report that about 40,000 people are bitten and about 3,000 people die. And this is the Lancet report from last year. The short history. So the history of treating snakebite in Nepal is indeed short. It started about 25 years ago when in south central Nepal, one Dr. Chabilal Thapa thought that he would try to help people, that he was seeing so many victims of snakebite, and he thought, let me try with antivenom. And he had some success, and in his clinical practice, in his limited area in south central Nepal, he did the best that he could. And then he's still alive today. He's quite an old gent, and he's the elder statesman of the cause in Nepal. And then about 15, 18 years ago, a young doctor came on the scene, and that was Dr. Sanjeev Kumar Sharma. And he saw that all these people were dying, and he was convinced by Chapuis to maybe look into the snake bite. And Dr. Ulrich will tell the story more completely after this talk. And not only did he succeed in treating snakebite victims with antivenom, but he also took it to a higher level. He started doing the first publication, international publications on the plight of snakebite in Nepal. And he went abroad and he talked about the plight of snakebite victims in Nepal. And so he put Nepal on the snakebite map, you could say. And then that brings the story, the simplified story, down to me about 9 years ago when I became involved with this project. And Dr. Sharma came to our Rotary Club and he told us about the problem of snakebite. And at the board meeting later that week, our president said, oh, well, why don't we do more needs-driven program? And why don't we help this young doctor? And I put up my hand very innocently and I said, okay, well, I could try to help him. And that became the beginning of our collaboration. And I first started working with him, helping to edit papers that he was writing and so on. Then I thought, well, no, I can do a little better than this. And because I live in Kathmandu and because he lives in the rural area, it is much easier for me to do fundraising. So then I did fundraising, working with him, and we raised quite a lot of money, actually, that he used to give training to young doctors and paramedics. And in the end, about 119 doctors and 348 paramedics were trained with the money that I was able to fundraise. So that's how it started. And then people said, well, you know, now that you're doing this work, why don't we have an international conference here on snakebite here in Kathmandu? And that's how the idea came about. And I did fundraising and I was the main coordinator for the conference. And that was held in August of 2019. Here it is. And it was considered such an important event in the history of Nepal that our president, the Right Honorable Bidya Devi Bandari, hosted the inaugural session at the presidential palace. And you'll recognize some of the participants: Dr. Faiz, Professor Kush, David Worrell from Oxford, David Williams from WHO, Diana Barr, Dr. Poon, and so on. And these are from our Ministry of Health, and Dr. Sanjeev here, of course. So again, Ministry of Health, David Williams, WHO. We invited everybody to the conference, everybody who's even just marginally involved. The Nepal Red Cross is active in treating snakebite in the east, and the Nepalese army is very, very active also in treating snakebite, and they also came. The Rotary Club, our district officials attended, and all in all, we had more than 200 persons. We did, as part of our fundraising, we also raised travel grants for 40 young paramedics and young doctors to bring them up from the Terai so that they could experience their first international conference. So everyone was included. So then what? So on the afternoon of the second day, Professor Worrell held an informal workshop, a talk program with the people in the audience. So we have international people, we have the young doctors, we have doctors from Nepal. And his question to them was, now what do we do? What is the way forward? How do we go ahead here? And there were different opinions. There were the opinions on antivenom, improving antivenom. There were opinions on tourniquets, yes tourniquets, no tourniquets, splinting, not splinting. A variety of opinions were expressed. But one thing that everyone expressed across the board is the need for awareness and prevention. So all agreed that Nepal would benefit from a public campaign on awareness and prevention of snakebite. And this was detailed in our summary report. So now, what did I have in hand? Now with the summary report in hand, I had the needs assessment. And with the needs assessment, where did we go from there? We had to determine who is Nepal's snakebite prone population. They are the poorest segment. They live in rural areas in Nepal's Terai belt. They have poor access to information. The literacy is low. They're highly illiterate, and they speak multiple local languages. Do they have access to treatment? Transportation in rural areas is a challenge, and ambulances are few. Nepal's doctor per capita ratio is low, and the funding is scarce. But antivenom is available, and this is really a crucial point. The antivenom is provided by the government free of charge. Unfortunately, many doctors do not have training in treating the snake bite. So, okay, how can civil society help? With the needs assessment and with an understanding of who is the population, what can we do? The government and the WHO recommend greater involvement of civil society. We decided that it was possible to design and implement a nationwide campaign for awareness and prevention. So Rotary is the partner. There's the symbol for the Rotary, and particularly through our Rotary Club of Kathmandu Midtown. And so was born the Nepal Snakebite Prevention Campaign for a Nepal where no one dies from snakebite. This is a 4-year campaign for public awareness and prevention. This is the first year. We actually launched the program at the end of the season last year, but this is the first year that it is being implemented in full force. Our vision is very simple: for a Nepal where no one dies from snakebite. Our mission to share information for awareness and prevention of snakebite, and our goal. Our goal is to reduce morbidity and mortality due to snakebite in Nepal. So the first thing we had to do was to build partnerships. Because we're only a civil society group, how do we build the partnerships and who do we work with? So our working partners, so first and foremost, the Rotary Club of Kathmandu Midtown. We made friends and affiliation with the World Health Organization office in Nepal, and they've been extremely helpful for us. This is the BP Koirala Institute with its affiliated Snakebite Research Center. This is one of the largest teaching campuses in Nepal. It's over a 700-bed hospital. The Ministry of Health, the Department of EDCD, Epidemiology and Disease Control Division. This is a small department with an enormous mandate. They handle the COVID, they handle malaria, they handle zoonotic diseases, malaria, and so on. And they are quite a small department. And Ministry of Health, the National Health Information Center, who is in charge of communicating on health matters. Do not underestimate, as an outsider, how difficult it was to make these liaisons. First, you are regarded with great suspicion. Who is this outsider who is trying to talk about these snakebite? But also do not underestimate how important it is to have these partners and to have these people on your side. You really can't do this alone. You really need these partners. And our technical partner, of course, Dr. Sanjeev Kumar Sharma at the BP Koirala Center and the Snakebite Research, and he is really our key technical advisor. Our implementing partner, we hired a small company in Kathmandu to help us prepare the knowledge products and especially the radio materials that I'll be highlighting in a few minutes. So now we have the funding, we have the partners, we have the vision. Now, what do we want to do? What are the key messages that we want to get to the audience? So the key messages for awareness and prevention, and these are not things that we just sat down one afternoon and invented. We use the existing guidance from the WHO, and we worked in collaboration with the WHO Nepal office, with the BP Koirala Center, and with the Ministry of Health to help refine these messages so that they are really applicable to Nepal. And also this got us great buy-in from the partners because they were in from the beginning. They helped us to develop these key messages. So what are the messages? The messages are very simple. The messages for prevention. What we want to tell people, keep your surroundings clean. If there are piles of garbage and twigs and so on, the snakes can hide there. If the area is clean, you can see the snakes. Beware while walking around at night. Beware while working outdoors. Stay away from areas that might hide snakes, and sleep under a net to help avoid snake bite. The key first aid messages: help keep the snake bite victim calm. Do not feed the victim anything. Work quickly to get the victim to a healthcare facility. If there's no ambulance, use a motorcycle. And don't play with dead snakes, but take a picture if possible. And also remember that snakes are part of the environment. Don't wantonly kill snakes. They're part of the natural ecosystem. So now we have the funding, we have the partners, we have the key messages. How and where do we give out these messages? So what is our communication strategy? Okay. The first thing that we knew for sure was that the materials had to be delivered in all 5 languages. Okay? The people who live in the remote areas, especially the older people who haven't had a chance to go to school, they don't speak Nepali as a first language. So you have to approach them in their own language. And we identified the 5 key languages besides Nepali: Maithili, Bhojpuri, Awadhi, and Pashmi Taro. And all of our messages are in these 5 languages. Okay, so now these people are very poor. They live in remote areas. How do we get the message to them? We can't put it on the television. They're too poor. They don't have a television. We can't do it in print media. They're illiterate. They don't read the newspaper. How do we penetrate to the hinterland, to the remote areas of Nepal? And what we realized was that even the poorest rural worker in Nepal still has 10 rupees for 2 AA batteries to listen to the FM radio. And it is really the FM radio that connects people in the hinterland to the outside world. So we decided to go ahead and make a media campaign, but that our first priority would be to do it on the radio. And for that, we designed 14 different public service announcements. That's 10 from the key messages that I just explained, and then 4, one for each for a description of the 4 major snakes. They're 90 seconds long, and they're broadcast every hour on the local FM radio. And I'll be showing you an example in a few minutes. Now, 90 seconds is not very long to get the whole message across. So we also designed radio magazine discussion programs that are like 20, 30, 40 minutes long. And these are discussions with the host and experts, doctors, army people, people who have been victims, just to help elaborate the problem. And these are translated into the local languages. And we have 4 of these new shows every season. So after the radio, what else do we need? Well, it would be nice to have some posters for the schools, for public areas, and I'll be showing you that in a moment. After the posters, social media. Okay, now, some of you may be sitting there having a good chuckle. Isabella, you told us that these are the poorest people. Now, why do we need a message on the social media? And the reason we need a message on the social media is that we very soon realized that we really have 2 audiences. One audience is the poor potential victims, but the other audience are the healthcare workers and the more educated people in the society. And they have access to social media. And I'll give you a statistic. Nepal is a country of 30 million people, but we have 42.5 million mobile phone subscriptions. So the mobile phones are ubiquitous. And the young people have access to the social media, Facebook and so on. So it is very important because they are the intermediaries between our message and the rural workers. So we have action clips, and I'll be giving you an example of that in a few minutes. Website. Okay, again, Isabella, these people are so illiterate. Why do they need a web page? And I'll show you how we have very creative use of the web page to help connect victims with doctors. Now in the next, and the very last, we have in person, believe it or not, in addition to websites, social media, radio, going out to the field in person is also very, very important, and we do it. My team and I, we've been out to the field 2 times, and that is to make connections with teachers, healthcare workers, journalists, and we also use, we're going to be using a training video to do that. And when you have this communication, person-to-person communication, you will find that people jump out from the audience and want to help you. These are the local champions. These are people who you can enlist to help you get the message out. And that's what we have been doing. So let's take a closer look at how we deploy the radio messages. You may all know Nepal is a mountainous country, and yes, it is indeed a mountainous country. How much time do I have? Okay. Okay. Oh, they haven't been hearing me. Oh, okay, okay. So Nepal is a country that's 700 kilometers from end to end and about 200 kilometers north to south. And in this 200 kilometers, we go from sea level to 8,848 meters at the top of Everest. And this area here, our Terai Belt, is more or less at sea level. It is the long open border with India. What we show here are the radio stations. Since this slide was printed, we've added another 24 radios, and it's color-coded for the language. In this green area, it's Pashmi Taru, the yellow is Awadi, the orange is Bhojpuri, the pink is Maithili. And this is where the radio messages are broadcast. And these long lines, these are our national carriers, Radio Nepal and Radio Kantipur, and they broadcast throughout the entire country in Nepali. How far do we get with the radio? Oh, the gray area, it's still Nepal, but it's a more mountainous area where there really are very, very few snakes. So this is a picture of the whole country, and what we have highlighted is the Terai area where the majority of the conflict with snakes occur. Sorry, I should have clarified that. How far do we get with the radio? Not advancing. Oh, okay. So with Radio Nepal, we reach about 4.7 million listeners. Radio Kantipur, these are the two national carriers. And with the local FM station, 3.5 million. Now we've added more, so maybe 5 million. So we really have very good penetration throughout the country. Now, I just want to ask, are there any Nepali speakers in the audience? Maybe our friends from Bangladesh? No? Okay. What I'm going to play for you now is the public service announcement. And okay, there are no Nepali speakers in the audience, but I will play it for you anyway. It's only 90 seconds long. But even as a non-speaker, you should listen for 3 things. The first thing is that the message is not didactic. The message is told in the form of a little radio drama. Okay? It's the conversation between a mother and a daughter. It's not uncommon in the rural areas to go out to the fields for bathroom. And so the mother and daughter are discussing, if we have to go out in the middle of the night, how should we do it? And the mother is advocating for using the torch or a stick. And at the end of the little radio drama, then the announcer comes on and summarizes the message. So the first is that it's a radio drama. The second thing you can listen for is that there's a little piece of music that plays. And that is special music that we commissioned from local musicians, and it is our branding. So all of our radio products have this same little piece of music, and it brands our products. And the third thing you should listen for is right at the end. And right at the end, we give the credits. We give the credit to the Rotary Club. We give the credit to WHO Nepal. We give the credit to the BP Koirala Institute, and we give the credit to the Ministry of Health. And this is, we hope, is an assurance of quality to the listener that this message has value and it has been checked. Okay, so please stay with me for the next slide. It's going to play in Nepali.
आमा राति छ कता जान लाग्नु भयो नि
पिसाब लाग्यो चर्पी जान लाग्या नि
ए पक्नु त्यसो भए म टर्च लाइट र लट्ठी दिन्छु लिएर जानुस्
किन नि सानो लट्ठी र टर्च लाइट
किन हुनु नि आमा रातको समयमा बाहिर निस्किनु पर्दा वा टोयलेट जानु पर्दा जहिले पनि टर्च लाइट बालेर र लामो लट्ठी लिएर मात्र जानुपर्छ किनकि बर्खायामको समय छ सर्पहरू हुन सक्छन् टर्चको उज्यालोले सर्प देख्न सकिन्छ र लट्ठीको टकटक आवाज सुनेर सर्पहरू भाग्न सक्छन्
कति राम्रो सल्लाह दिएको सानो तिमीले
आमा हामीलाई नि स्कुलमा म्याडम सरहरूले सर्प लुक्न सक्ने स्थानहरूबाट हिँड्नु परेमा वा काम गर्नु परेमा जहिले पनि थप होशियार हुनुपर्छ भनेर सिकाउनु भएको छ नि अझै धानबारी झाडी अथवा अग्ला घाँसहरू भएको ठाउँहरूबाट हिँड्नु परेमा लामो लट्ठी लिएर टकटक आवाज गर्दै हिँड्नुपर्छ भन्नुभएको छ
सर्पहरू वर्षायामको समयमा सुक्खा ठाउँमा बस्न मन पराउँछन् आफ्नो वासस्थानमा पानी पस्ने हुँदा सुक्खा ठाउँको खोजीमा उनीहरू बाहिर निस्कन सक्छन्
मुसा कुखुरा जस्ता आहारको खोजी गर्ने क्रममा पनि सर्पहरू मानव बस्ती नजिक आउन सक्छन्
नेपाल सरकार स्वास्थ्य तथा जनसङ्ख्या मन्त्रालय इपिडेमियोलोजी तथा रोग नियन्त्रण महाशाखा र राष्ट्रिय स्वास्थ्य शिक्षा सूचना तथा सञ्चार केन्द्र वर्ल्ड हेल्थ अर्गनाइजेसनका साथै बीपी कोइराला स्वास्थ्य विज्ञान प्रतिष्ठान सम्बद्ध सर्पदंश रोकथाम केन्द्र संघको सहकार्यमा रोटरी इन्टरनेसनल एवं रोटरी क्लब अफ काठमाडौँ मिड टाउनका साथसाथै विश्वभरका रोटरी फ्रेन्ड्स एवं पार्टनर क्लबहरूद्वारा जनहितका लागि प्रस्तुत सन्देश
So that was the Nepali one, and we have in also 4 other languages. So now I want to give you a few examples of how the messages are illustrated visually. So we'll start with the first one, and this is the keep your surroundings clean message. And again, it's color-coded consistently in the 5 languages. And now these cute little cartoon characters, these are not just some characters that we made up. This is the indigenous art of the Maithili people of southeastern Nepal. And we use that. For example, in this one, we tell them, keep your surroundings clean. In the next one, we tell them, mice hide in food storage. The snakes are attracted to the mice. Be careful with the food storage. This is be careful at night. At night, use a torch, use a stick. When working in the fields, use a stick. Be careful. Oops, sorry, this is the other direction. At night, it's been shown that just by using a mosquito net, the snakes are prevented from coming too close. So use a mosquito net at night. This is keep the patient calm. Okay? This is if you don't have transport, find somebody with a motorcycle. Put the patient between the driver and the pillion rider. Hold the patient and just go to the healthcare facility as soon as possible. This is don't play with dead snakes, but take a photo. So many people have mobile phones now. Take a photo to show the medic when you get there. And our last message, remember that snakes are also part of the environment. There are a few others, but I'll leave it to you. We commissioned the art from the Maithili women of Janakpur, and we gave them the 10 messages, and they provided tiles for us. And then with the magic of graphic arts, we put all of the tiles together and we assembled them into these 2 posters. And just to give you an idea, what do the posters look like when they go out to the field? They're printed on very heavy cardboard and are double-side laminated, okay? So to withstand the rigors of the monsoon season in Nepal. All of these materials are also available, and okay, here we go. The picture with the poster, okay? And I have, they also come in a small format pamphlet, and there are a few up here for those of you who are interested. Now we go forward to our social media. And on the social media, we have now more than 1,000 followers. And this is how we can communicate with the young healthcare workers, the young professionals. When we have a question, we can post it on the social media and get a flood of answers. But I want to show you the action clips that we have created from the artwork that I showed you before. So for example, I want to show you the action clip that's associated with this Beware at Night. Again, I know that there are no Nepali speakers in the audience, but I'm going to play this short clip anyway, so that you can have an idea. As the language plays, then the words come out in that language. And for those of you who want to follow, right at the bottom of the screen, you will see the English translation. So let's see how that works.
सर्पदंशबाट सुरक्षित रहौं, रातमा सावधानी अपनाउनुहोस्।
लामो लट्ठीको प्रयोग गरी जमिनमा ठ्याक ठ्याक बजाउनुहोस् र रातमा सधैँ टर्च लाइटको प्रयोग गर्नुहोस्।
सर्पदंश से सुरक्षित रही, रात ख सावधानी अपनाई।
नम्मा लट्ठी प्रयोग गइख भुइँमा ठ्याक ठ्याक झटक्क बजाई हो, रात ख सड्ड टर्च प्रयोग गरी।
सर्पदंश से सुरक्षित रहा जाए, रात में सावधानी अपनावा जाए।
लम्मा लाठी के प्रयोग करके जमीन पर ठोक के बजावा जाए और रात में हमेशा टर्च लाइट के प्रयोग किया जाए।
सर्पदंश से सुरक्षित रही,
रात में सावधानी अपनाई।
लम्मा लाठी से जमीन पर ठक ठक बजाई और रात में हरदम टर्च लाइट के प्रयोग करी।
सर्पदंश से सुरक्षित रहे, रात में सावधानी अपनाबी।
नम्मा लाठी से जमीन पर ठक ठक बजाबी और रात में सदखन टर्च लाइट के प्रयोग करी।
Okay, so now we have the social media, and let me tell you a little bit about our webpage. The webpage is available in 2 languages, in English and in Nepali language. And please, I invite you to visit our webpage. But what do we have available on the webpage? The webpage is a virtual repository of almost all that's known about snakebite in Nepal. We have the WHO publication. We have the WHO publication that is specific to Nepal. We have the Guide to Venomous Snakes, which is a photographic guide. We have the messages again here repeated, and we have contact information in case of emergencies. So let's see what that looks like. So we tell them, keep the patient calm, transport the patient, use a motorcycle, but use the tables on the webpage to locate the closest anti-venom treatment center. If you don't have transportation to reach the center, use the tables to find a health worker who can advise you over the phone, okay? So these are the tables. They're continuously updated. They're also updated through crowdsourcing. They're divided by province and by district. They have the name, the location, and the phone numbers for the medics. So should there be an accident in the village, the rural workers won't have a phone, but there's always someone in the village who has a smartphone. We tell them that message over the radio. Go to the web page. They'll be able to go to the web page. They'll have the name, the location, and the phone number. They can phone ahead. Hello, do you have antivenom today? If the doctor says no, phone the next one on the list. That one doesn't answer, phone the next one on the list. That way, when you put your victim on the motorcycle, you will be able to go to the closest place and you will know that there is antivenom. But this takes some education, you know. They have to hear this many times on the radio, and especially the young people, they have to know to go to the web page to act. But even though it's going to take a little bit of education to get this popularized, this is the very first time that this information has been made widely available. Okay? So it's a kind of a poor man's telemedicine. And even if you can't get to that health center, at least at the end of your phone, you will have a trained medical professional. You will not be at the mercy of the local traditional doctor. So what have we learned so far? Okay. That it's important to understand the behavioral patterns and the communication ecosystem of the target audience. Engage civil society. I know that for this audience, that is maybe think outside the box. I have been following the WHO programs on snakebite envenoming over the Zoom. And one comment that we hear repeated again and again, there's no funding, there's no funding. Well, people go to the health ministry, and the health ministries in developing countries are grossly underfunded. But think outside the box. Many developing countries have quite an active middle class. So they belong to groups such as the Rotary Club, Lions Club, other social clubs. They have some funding. They have funding available. Make use of volunteers such as myself or others who are interested in helping to solve the problem. Think outside the box when you're thinking about funding. Make partners absolutely essential. Alone, you will not get traction. You need to make those connections with the WHO, with the Ministry of Health, in our case, with the Red Cross, with the Nepal Army. And what we do at the beginning of each season is we have a Zoom meeting with all of these stakeholders, and we tell them what we're going to do. And at the end of the season, we have another Zoom meeting with all of the stakeholders, and we get their feedback. How did you think? How can we improve? Keep your stakeholders involved. Make those friendships and make those friendships work for you. Identify and engage local champions. Whenever you give a public lecture, you will find one or two people who are so excited to help you. They want posters. Give them posters. Give them all the help that you can get, because we're trying to cover an entire country here. There's no way that we alone will be able to do that. Make maximum use of social media. It's free and it's effective. Okay. Also use the social media for crowdsourcing. Let the crowd tell you where are the problems. Let them help you to correct any errors in the communication that can be on the web page or your social media. Make maximum use of the high tech. Use the Zoom meetings to communicate with doctors and stakeholders. Use crowdsourcing to gather information. Out there in the field, those young doctors, young paramedics, they're always on their mobile phones. They will communicate with you. Brand your message. Very important to brand your message so that they know it's one message, and keep the message consistent. The message that we give on the radio, the messages that we give on the posters, they all work together. the radio public service announcements, the radio discussion programs, they all use the same theme music. Make sure that it looks like a unified whole, that it is. Reinforce the message. What we're trying to do here, whenever I give this talk, people want to know, so did the numbers go down? So did the numbers go down? We're hoping that the numbers will go down eventually. But what we're really trying to affect is behavioral change. And this takes time. It takes time for people to start to think, to know, to go to the web page, keep the environment clean, go quickly to the healthcare post, and so on. So the messages need to be repeated many times in many different forms before we begin to see change in the numbers. But having said that, we have some very early reports from Western Nepal. One doctor there is telling us that he's seeing a slight decline in the numbers of reported cases. So let's hope for the best. I want to thank the Rotary Foundation, who is funding this 4-year program. This is the end of the first year. The snakebite season goes from May to September in Nepal. So thank you very much to the Rotary Foundation and also to all of the local people who helped us in Kathmandu. The team, so the team is myself, Dr. Rizal, who's a communications expert, and Ms. Parajuli, who is an education expert. And we want to thank Rotarians and friends from around the world who have supported this work. A big thank you and a namaste to the Swiss Embassy in Kathmandu, who helped to fund the first international conference. A big namaste to the Australian Embassy, who helped to fund the training of those doctors. To Rotarians from Australia, United States, the Republic of Korea, Japan, to Dr. Rupjoti, who gave us the seed funding to apply for this Rotary grant. A big thank you to all of them. Do we want to do a survey? So in the survey question, I would ask, does your country have a program for awareness and prevention of snakebite? Yes, throughout the country. 1, okay. Yes, only in some areas. Yes, it's taught in the schools. Okay, 1. No, it's not available at all. So in the majority, I would say, I don't know what you're seeing online, but okay. And the second question I want to ask is, who funds the awareness and prevention program? In your country, is it funded through the Ministry of Health? Is it funded through NGOs or others? And maybe I'll ask one follow-up question. How many of you have ever heard of the Rotary Club or ever thought about joining the Rotary Club? And I would strongly urge you to please do that. They're a very friendly bunch, and you can use them for fundraising, and I think you will see that they will be very happy to help you. So I think that's it for me. Thank you.